Hello, hello. It's good to see you right here on Your World. It's Wellness Wednesday right here on the show. And as you all know, every single Wednesday we talk about anything and everything health. And I know last week we had a conversation on back pain and we promised to continue with the conversation today, but we're taking a pause, okay, on back pain and also address an equally very important conversation to have, and this is as far as sickle cell disease is concerned. So that is what we'll be focusing on the show today, and then hopefully next week on Wednesday, then we'll continue with back pain. But really, I hope that you're well this morning. Thank you so much for making the time. My name is Winnie Lubembe, and the show is Your World, just in case you're tuning in today for the very first time. And like I said, we'll be focusing on sickle cell disease, and today we'll be speaking to warriors and caregivers as far as living with sickle cell is concerned, because yes, we need to understand more on the same, because there's so many myths, there's so many misconceptions, there's so many misinformation and disinformation out there. So really, you know, it's important for us to continuously have this conversation so that we are all clear, okay, when it comes to sickle cell disease, and also hear from the warriors, what exactly is it like living with sickle cell? What is their day-to-day like? You know, what do they do to, first of all, understand when it comes to diet, but also just, you know, do to help themselves, and especially when it comes to like crises and all those things. So it's going to be an amazing conversation, an educative conversation at that matter. You want to stick around until the end of the show. And before you meet our panelists this morning, we have a question for you. And the question says, so what question would you like to ask on the show about sickle cell? Again, what question would you like to ask on the show about sickle cell? That is what we are asking you today. So whatever question, whatever, anything that you have that say you want to hear from, especially from the warriors, feel free to engage with us on our socials, and that is at NTV Kenya across all board, and also on our WhatsApp number 0112-500-400, or better yet, give us a call and ask your question or contribute to the discussion. If you are a warrior who is watching us this morning and you want to share your story with us, feel free to do so. Or if you are a caregiver and you also want to chime into the conversation, by all means, feel free to do so. Our lines are officially open. So let me introduce my guest, and as per usual, tunaanza na huu mkono wa kushoto, on my left. We have Lawrence. It's so weird for me to call you Lawrence because we know you as Kokoto ni Jody, but leo amesema leo yeye si Kokoto. Leo ni Lawrence Guaco, who is a dad and as well as a sickle cell ambassador. Good to see you. Good to have you on the show. I don't know how to keep serious. Like ni sawa tu. We will try. We will try. Sindio?
Hata mimi ndajaribu leo kwa serious.
Yeah. But thank you so much for coming by today. We also have Wesley Obama Guaco. Hey, yeah, Wesley. Good to see you. How are you? Naendeleaje? Unasikiaje leo?
I'm fine.
Yeah.
Uko tu poa.
I like that. Karibu sana on the show. First time here.
Yes.
On Your World. Uliwatch Daddy ile siku alikuwa pa last time ama ulikuwa shule?
Yeah, niliwatch.
Uliwatch? Ulicheka ama ulikuwa tuzileza? That's my dad. You know? Umezoea.
Si tumemzoea saa.
Umezoea jokes zake? Sasa amekuzoea. Wewe hata, you know, tumekuzoea. All right, and we also have Teresia Adhiambo, who again living with sickle cell disease, joining us this morning to also just share her journey. Teresia, good to see you.
Good to see you too.
Thank you so much for making the time. I like the red. It looks really good, you know? It looks really good.
Thank you so much.
All right, and we also have Eunice Awino. Eunice, Eunice, where did you go to? I mean, global, eh?
It's global.
Physically global, eh?
Happy to be
the
here.
global sickle cell advocate. Thank you so much for making the time. It's really good to see you after such a long time. And now, tulikuwa tunasema mtupatie skincare routine, hivi, because you all look amazing. Thank you so much.
Water.
Water. Bas, drink your water. Wamesema kunywa maji, hydrate, hydrate.
Yes.
And of course, at the back we also have, you know, some of our warriors and our caregivers. Do you want to just introduce ourselves very quickly? Whoever on the mic, yes, let's start with you.
Okay, good morning, everyone.
Good morning.
Good morning.
My name is Beatrice Opany. I'm a caregiver. I'm a proud mother to an 11-year-old boy who is a warrior from sickle cell disease.
Fantastic.
Thank you for having me.
And thank you so much for joining us today.
Good morning.
Good morning.
My name is Bavon Emmanuel, and I'm a sickle cell warrior.
Fantastic. Fantastic. Karibu sana. Thank you for joining us.
Good morning.
Good morning.
I'm Jacqueline Oyamo.
Jacqueline, yes.
And I'm a Sickle Cell warrior.
Karibu sana. Thank you for making the time. All right.
Hello.
Hello.
So for me,
Do you want to speak closer to the mic? Yes.
I'm not sure to say which name. Actually, my real name is not known.
Yeah?
Yeah, so people call me Genius.
Genius?
Yeah.
Okay. Okay.
Yeah.
Hey.
Dr. Genius.
Dr. Genius. Hey, ilitoka wapi
But
Dr.
my name
Genius?
is Joseph Nunda.
Joseph Nunda.
Yeah.
Dr. Genius ilitoka wapi? I'm really curious now. Eunice is laughing. Eunice knows the story. Sindio? I'm tu when I'm genius too. No. You know? Ilitoka wapi? There's a story behind it, Maybe utaniambia tukiwa break. Aya, sawa. But Eunice, let's start with you. Sickle cell, and like we said, today we want to hear from the warriors. Most of the time when we talk about sickle cell, yes, we have a doctor to explain, what it's all about. But let's hear from a warrior. Sickle cell, from where you sit. Just make it clear for the people who are at home and want to understand what it's all about.
So for me, I can say sickle cell is one of those inherited diseases that have been neglected for many years. Until we started doing advocacy and education is when now people are coming out, and actually there's a lot of research going towards finding a permanent cure towards sickle cell.
Yeah.
But in Africa, we are still a bit far, because maintaining, managing, and just going through all the therapies and bone marrow transplant that one needs to care for, it's very expensive. So right now what we are doing is advocating and making sure that our voices are heard and that the Ministry of Health, together with every single person out there, knows what sickle cell is all about. And if we can continue being given our drugs at a subsidized price, because that is what helps us. Because once you're diagnosed with sickle cell, take it positively. Some of us are here. There are people who are older than myself. Because I've been living with sickle cell for the past 44 years. So I call myself 44 years young.
Yes.
And sickle cell does not wear me down. I overcome it every single day. I live a day at a time, and that's what has really kept me, and plus faith and just believing in myself. Because growing up in the 80s, nobody used to talk about sickle cell. It was a taboo. It was like that family, they have this disease, and it used to kill so many people. So what happened, if I go back to history, we all know how COVID came. It was a world pandemic, and it killed so many people. That's what happened when malaria came and killed a lot of people in the world. So what happened, the people who did not die from malaria, they ended up having one deformed gene. So we call them sickle cell carriers. Those are our parents, because I have SS. So you find like our parents ended up being protected because they had one perfect gene and one imperfect gene, which was S. So what used to happen when malaria parasite will bite them, the sickle gene that they had used to kill the malaria parasite. So they are protected from getting malaria. And now you find because a lot of people died, so you find the carrier and the carrier are the ones who survived, and they ended up marrying each other, and they started having children with sickle cell. And because there was no research around that, the children started dying. And now people are wondering, why is it that this family, this woman is married there, and all the children are dying? And this is something the parents need to know. It's not from one parent, it's from both parents. Yeah, because the gene has to come from one gene from your mom, one gene from your dad. It's when now you end up having a gene called SS. I believe when a doctor comes, they'll be able to break it very well. So me, I talk as an advocate because that's what I do every single day.
Absolutely. And Teresia, what would you say is the most misunderstood either part or what is that one thing that is very misunderstood, especially when it comes to sickle cell disease or living with sickle cell?
I'd say two things. One, people thought it was contagious. It's not contagious. It's something, like she said, you inherit from both parents. And the other aspect would be how we live our lives. People, back in the 90s, people used to assume we wouldn't make it past 18. So The ones who were there earlier had to live life a bit limited. And then now when we got past 18, then we realized, wait, we've gone past 18. That means we can actually live our lives like normal people.
Yeah.
So it's just basically management. But we're pretty much normal people, as you can see. Yeah.
I mean, listen, I don't know what this thing was about 23. You know, and then after 23, then they say 27. Yeah. And then after 27, I mean, Eunice is here saying, listen, I am 44 years young and very healthy. So it's really good to hear that and see that, listen, no, there's actually life beyond the 18-year mark and 23-year mark and 27-year mark that, people have always been put to a box that sometimes even parents and caregivers, would be absolutely worried about.
So that used to happen a lot. Yeah. Reason being, doctors never saw somebody beyond 5 years. And that's what now they studied in the university. They were told children who are born in Sub-Saharan Africa will never celebrate their 5th birthday. Yeah. If you pass past 5, then they give you to 7. So it used to be 7, 14, 21.
Yes. Yeah.
So after that, now we are here. They didn't know what to do with us. So now in Kenya, I can say now we are having more physicians for adults than before, because most of us, I'll not lie to you, we still see our pediatrician because they have our history.
Yes. Yeah. And it's important to actually keep that, and especially when you're like saying going to a doctor, because then they will start asking, all these questions that you have to go back and forth. So just having that record is pretty much important, right? Yeah. Okay, we'll come back then and address much of that. But let's speak to you, Lawrence. I will try as much. And remember, right?
I find it weird, Pia Mimi.
You'll be like, Lawrence, we are in New York. Yeah, so let's hear from your perspective as a dad, as an ambassador, and a dad to Wesley. So tell us a little bit, because again, Eunice talked about careers. So tell us a little bit about you and, and Wesley's mom, and then we'll talk a little bit about Wesley as well, and then when, the diagnosis was given.
Yeah, actually, to me, like, being a caregiver to this young dude, at first, after the diagnosis, coming to terms and accepting that this is what it is, that was the biggest challenge. And before we came to terms with what was actually happening, we had a number of breakdowns, emotional breakdowns, because we were like, vile tu Eunice amesema, like mtu akiwa na sickle cell, it's 7, akipita 7, 14. After 14, now sasa mujitayarishe, inakuwa ni mazishi. But things just happened, things just happened. It was so difficult accepting it, but the moment, after going to the clinics, talking to experts and all that, when we came to, accepting that this is what it is part of our lives, we just have to know how to manage it and how to live with it. And we accepted, and after accepting, I think I can say things are pretty better. Yeah.
So we have
because apart from now the doctors, inakuja sasa kwa sisi wazazi. You have to even talk to talk to the child mwenyewe, umpatile moral that it's okay. It's just a condition. Tutatoboa, you have to keep, kumpatia hiyo
and just being
moyo.
Positive.
Yes,
right?
And being positive.
When was that? Like how soon after birth, after, growing up, did you guys know? And first of all, did you even know about the whole career
we didn't know. We didn't know because after 8 months after birth, that is when he started having those, pains, swelling of hands, feet, mwili, nini. So we went to this hospital, nini. And then back then, like in 2008, it wasn't that open that watu walikuwa wamejua that if you see these signs unaweza kimbilia mahali fulani. So by the time we came to know about, you know, there is an hospital ambapo unaweza enda wakadiagnose nini na nini, we took a lot of time kukimbia around, you know, this hospital to this hospital to this hospital, kudiagnosewa na vitu zingine aziko, but eventually akadiagnosewa, we were told now he has sickle cell.
Okay.
So from there now we started following the clinics, kwenda hizo ma sessions, kuongeleshwa na nini na nini na nini. Yeah. And from that time it's now 16 years and counting, and we are proud and we thank God.
Yeah. I like that. I really like the positivity. The misdiagnosis part of it, we'll talk about it. Is it something that we see, you know, as common? Could we have more people, you know, living with sickle cell that probably don't know because of go to one hospital from Nasema, you go from one hospital to the other, but you're not told what exactly you know the issue is. So we'll address that you know, and especially during the second hour when we have a doctor here. But Wesley, so at what point, when did Daddy tell you, sasa, you know that conversation where unakalishwa chini unaambiwa sasa hivi ndio kuko, this is what you know we are dealing with, and how was that for you?
Kitu ya kwanza actually nilikuwa naijuanga njo after hiyo 8 months nikiwa mdogo mimi niliona naanza kumeza madawa.
Okay.
And then at least when I was 5 years old, ndo nikakujanga nikolzanga madawa ni za nini?
Yeah,
mbona nameza dawa, mbona saa zingine nashikwa na uchungu. Akaniambia, ndo sasa akanikalisha chini akaniambia uko na sickle cell. Ndo nikamuuliza ni nini, akaniexplainia ndo at least ndo nikajua what I'm dealing. From that day mimi naendeleanga tu.
Yeah. So ebu tuambie, ukisema so ulikuwa na meza madawa alafu juu ya uchungu, okay? Again, I know this might be difficult to express hiyo uchungu like from a scale of 1 to 10. Hiyo uchungu iko aje?
I give it 10.
You keep it at 10. Whew. Okay. And then at what points would you, like, what instances ungekuwa unasikia hiyo uchungu? Is it like every single day? Is it, you know, one off? Are there like specific times, either say during the day or at night, that ungekuwa unasikia hiyo uchungu?
Okay, saka hizo crisis zikinipata, actually nakwanga unaweza pata nikimeza madawa mchana, itaka at least 2 hours and then a strike back. So ilikuwanga at least nikaa tu every 24 hours. Kwa sababu nikimeza dawa zile strong painkillers itatulia, and then later ita hit back, itakuwa painful.
Okay. And at what points, like ni wapi unasikia uchungu exactly?
Ina depend na pali imeshika. Kani mkono utalilia hiyo mkono. Yes.
Na umesema ni 10. Hiyo uchungu ni 10.
Ni 10.
Hai. Huwezi lala. Oh wow. Okay. Yeah. Okay. Si tuchukue after break. Ndio nisikuharakishe zile za thank you. Right, so let's take a break. But yes, and now you have, you know, slightly a bit of a picture when you know we talk about crisis and whatnot. But we'll come back and talk about it even more after the break. And remember, the question that we are asking you today is, what question do you have for us, you know, as far as sickle cell is concerned? What question would you like to ask on the show about sickle cell? We'll also look at your feedback after the break and all your questions, and take you know, the phone calls if you want to call us, or use our WhatsApp number 0112 500 400. So there's so much to come on the other side. Do stay with us. All right, welcome back to the show. Yes, like we always say during the break, the conversation still continues. And just in case you're tuning in right now, it is Your World, and today is Wellness Wednesday, and we are looking at sickle cell disease. But today we're actually looking at it from a warrior's perspective, and we have warriors here, and we'll also have caregivers as well, just sharing their journey and what it is like, you know, living with sickle cell. And all my days, you know, during the break, I'm like, oh my gosh, like, wait, what and what not? But Teresa, I want to hear from you. Because Wesley said, oh no, you wanted to chime into the point here, Wesley, right? And then I'll come to you, Teresa, I promise. Okay, go.
Okay.
Wesley said that walijua kama akona 5 years old.
Okay.
But for me, my mom knew that I'm a sickler when I was 2 months old.
2 months?
Yes,
Okay.
2 months old. So when she gave birth, I was sick already.
Okay.
So she went to Kenyatta Hospital, kufanya diagnosed, but they didn't see anything.
Okay.
So they sent her to Aga Khan Hospital. That's why walipata niko na sickle cell. So akaanza kuni manage. Akaambiwa what she can do. Because we are 8 in our family, so I was the 6th born with sickle cell. So the rest wako sawa.
Oh, okay.
So I was the first born with sickle cell. So alikuwa anashindwa hii ni ugonjwa gani? Hii ni ugonjwa gani? But at that time alikuwa anasema yeye hana. My dad pia anasema hana. So they are wondering imetoka wapi.
Yeah.
So you see. So hiyo management ikaendelea. So nilikuwa namwambia mama nasikia kichwa inaniuma. Hata ninunulie dawa.
Okay.
Mbio hospitali. That's why I'm here and I'm 36 young.
Look at that.
Yeah.
Wow.
And you talked about the pain.
Yes.
The pain is 100% pain.
100.
Yeah, imepita ile ya labor. Cause ikianza kukuuma hata mama mwenye anakutekea analia.
Oh.
So both of you are crying.
Yeah.
Yeah.
And then like Wesley said, when he said, kama ni hiyo mkono, una deal tu na hiyo mkono.
Una deal na
so
hiyo
it's
mkono.
not like pain, I don't know, not everywhere in the body, but sometimes it will feel like it's everywhere in the body.
It depends.
Yeah.
Kama inaweza kushika kwa mgongo, at the back, joint pains, chest.
Yeah.
So when in fact, I am a mom. So when I was pregnant, nilikuwa na acute chest syndrome.
Okay.
So unaisikia kwa chest and unasikia kwa mgongo. You can't sleep.
Yeah.
When you sleep in the right side, inauma. Ukisleep na left, inauma. Na back, awezi. Na kwa tumbo, awezi because you are pregnant.
Yeah.
So it's all over sometimes. So it depends. The crises are different.
Yeah. And we'll address the crisis and the difference in just a second. But Teresa, I wanted to hear from you because you see, when say for example, mtu akisema niko na malaria, the thing that we would expect, like the symptoms, what they feel is anaumwa na kichwa, ako na pain kwa joints, ako, you know, say what other disease, like any other disease, there's something that we can attach to and say, oh, you're feeling this and this and this and this could be this. So for someone who maybe doesn't really understand sickle cell disease from a warrior's perspective, what is it in terms of the symptoms, you know, to look out for? Because like you said, yours at 2 months, what the issue is here. And then you told us, you didn't even know, you figured by yourself.
Yeah, I have boomer parents, so they're not very communicative. Half of the things I had to find out for myself.
Yeah.
And I think they just let it be because even them, they were running their own lives at that point.
Yeah.
I'd say for a crisis, it depends. The older you get, the more you self-analyze, the more you realize, because there are certain pathways. You'll always realize this path leads to this path leads to that. So mentally, you're always like, when you wake up and maybe you're feeling, I can't say it. It's a funny feeling. You just know, today I should not go anywhere. Today feels like that day when things will take a U-turn.
When it's like you sort of like know when a crisis is about.
You can actually tell from a distance.
Yes. Yeah.
You can always feel it. You can't put it into words. Your body will just warn you, today is not the day to do extracurricular activities. Today you need to chill out. And also the complexity of it is, sometimes you self-analyze, you're like, this feels like any pain for a Panadol, you take it and it will go away.
Okay.
Or sometimes you're like, this feels like for a slightly strong painkiller, but now when you take that slightly strong painkiller and it doesn't go away, then you know, hey, I need to run to the ER because the pain is getting worse. And it's true, the pain does get worse. It starts very subtle, but somehow it's like someone is always turning up the volume on it. Yeah.
So we need just to channel what Teresa is saying. Behind you, the screen.
Yes.
So you see, those are I call them the small vehicles in our body that carry blood and oxygen.
Okay.
So with sickle cell, the
there
reason
we have
why,
it on the screen.
So the reason why we feel the pain that is very painful that you can't even bear it, it's like now the sickling cells, they all come and are stuck at your joints because it's like traffic jam. They are not moving. And when they're not moving, it means blood is not flowing,
Yes.
oxygen is not flowing, and it will end up affecting your body organs. So that's why I say sickle cell, it's a disease by itself. Because when now your body organs are being affected, other things start failing. Your kidneys, you end up having diabetes, you end up having avascular necrosis, eyesight, ears. So it's a lot. It's a lot, and that's why we say live a day at a time.
At a time.
Yes, because now when that pain is there, it's like traffic jam. The way you can see them, the sicklings are not moving. The normal person has the round, so round can just squeeze at any small capillary and move. But now because they're sickle, they end up being stuck on all those veins. So that's why it starts. You feel like it's here on your wrist. Then all of a sudden, your back, a bit your legs. Sometimes you can't even move because even your parent is wondering, how can I even carry you? Because everywhere is aching. You can't be carried. Everywhere is aching.
It's pain. It's pain. Okay.
But it's a funny disease because it can also just be your wrist. Only
is where you feel the pain.
So someone is like, why are you crying? It's just your wrist. But trust me, it's very painful.
Okay. You wanted to say something from a caregiver's perspective?
To add on what Teresa was saying. You know, when you are older enough, you are able to express yourself or analyze yourself and even tell your parents or your guardian how you are feeling. But now it is more trickier when the child is still young. Because in my case, the diagnosis was done, we started this journey at 6 weeks. Our first clinic. The boy was just fine. But the eyes were a bit pale, and you were like, it is in July, maybe it's because of it's cold, there's no enough sun, something like that. So when I took him to the hospital, the nurses were staring at me. I was just in the queue waiting to be served like any other patient. So these nurses were like, they were whispering and they're not telling me anything. So one of them at some point gained courage and came to me, and Mommy, are you okay? I'm like, yes, I'm fine. Are you from the ward or you're from home? I'm like, from the ward. Do I look sick? Why are you asking me that? And then she's like, come, follow me. I followed her to the room. The child got the injection, and then she told me to follow her again. I'm like, what is happening? Why are you not telling me anything? And then she whispered something to the nurses who are attending to us, the ones who are in the room, without even talking to me or explaining anything. So we went to a certain room, and then she told me that, you know what, you'll have to have these papers and go to the lab, do this test. Why am I doing the test? Is there anything that I should know? Just go and do this test, then give us the results. That was back in 2014 at Mama, I don't want to mention the hospital. So we went to the lab. The machine, unfortunately, were not working. So I was told, you know what, don't go back home. Just go to Kenyatta. Do this test and bring us the results. So I asked her, kindly, can you explain to me, is it that serious?
What is it?
Can't I just go back home and come back tomorrow? No, just go to Kenyatta. I took my baby, rushed to Kenyatta, did the test. It was a full hemogram test. We did the test. The HB was at 3. Yes. I can see the shock on your face. It was at 3. And I was told, I went back to the other hospital. So I didn't, with the confusion and all that, it didn't even click in my mind that at Kenyatta they have a pediatric department. I can just walk in, take the results, and then be assisted. So I went back to that hospital. They told me, what? You have to go back to KNH. I was tired. I was stressed. I was drained. I went back to Kenyatta. Walking into Kenyatta, it was an emergency. The HB is at 3. Yes. The baby looks okay. But they told me, you know what, we have to transfuse. We have to admit this baby. The baby had prolonged jaundice. That's the reason why the eyes were yellow. So they cleared the jaundice. We got admitted immediately. We stayed at Kenyatta for around three weeks. After that, we started following up. So it was every monthly, the pain, the swelling, the hands were swelling, the feet. Sometimes the baby cries like for 3 hours, non-stop. As a parent, you don't know what to do. Because you don't even know, the way Eunice was saying, you don't even know how to carry him. Because if you touch here, and he can't talk. It's not like Wesley who will tell you that, Mom, don't touch me here. So, in that period, caregivers are also getting drained. People mostly focus on the patient, forgetting that behind this patient, there's a caregiver who is battling silently. And this is something that should be addressed. This is what we are advocating for, so that people can come out. And this is one thing that is making caregivers pull back. Some don't even, in the community, some don't want to speak out because of how the community look at you. After you have given birth to a child with sickle cell disease, you are tagged in a certain way. There's a way you are labeled. Like an outcast. It shouldn't be so, because it's not something that you have by choice. It's not a choice. Every parent, when you are expectant, you are always praying for a child who is healthy, expecting the best. But it has come. What do we do?
What do you do? I say that.
And that is the conversation that we should be
It's a good thing that we're here today talking about it, and even having warriors here and caregivers as well to really come and say what it is. Because you see, again, like I said, most of the time when you talk to specialists, yes, they'll tell you what the disease is about, but then when you have someone who tells you, listen, sometimes I'm like, do not usinishike, because the pain is just too much that you don't even know how to handle it. I'd also like to hear from you again from a caregiver's perspective. But before that, so then, Wesley, how's like your day-to-day, like school, balancing school and being able to play with your friends and just having like a social life, being a teenager. How is that? What does your day-to-day look like?
Okay, for kitu ya kwanza, tukianzia tu shule, kuna challenges mingi kwa sababu most kids unajua au pia waja learn from the sickle cell, so hakuna mtu mwenye anataka kukaribia mtu mwenye akona sickle cell na ajui sickle cell ni nini. So kuna wengine watanichongoa, kuna wengine hata nikaribia, na kuna pia wengine courageous tu watakama along. Juu pia hata kushia vitu, kuna siku nilipoteza cup, nikaomba mtu cup. They told me that niliambiwa if I catch the cup, juu ni heavy, nitaanguka, mwili yangu yote itavunjika. So nilikuwa zile za kikombe unisaidie tu nikaachana nayo. So wengine pia hata kucheza nao ball unasikia, wewe msikubali, wewe akimbia usikubali, wewe akikimbia anaweza mwagika hapo chini. Sasa unaacha hadi kucheza nao, most unajaribu. Kuna wengine wataka na yeye, kuna wengine pia
And what does that make you feel? Because again, being a teenager, you'd like to socialize na wengine, sindio? You want to have friends, you just want to be a teenager and do teenage things. But then again, to have these people say all those things to you, what does that make you feel?
Okay, unajua mimi huelewa kwa sababu hakuna watu wamejua sickle cell.
About the disease.
So, me actually kama rafiki wenye wako na au unaweza sikia mtu akisema mimi niko na cousin yangu mwenye ako na ugonjwa, so au friends wenye cousin yake ama nini ndo nitachukua niachane na wengine. Ama nikuje tu mimi pia mimi uko na courage naweza ambiana tu, so siseve hivyo, naweza kwa na explain what sickle cell is.
Oh, I like that.
And later utapata we are just friends.
Wanaelewa. Oh, that's really nice. Yeah. So ukiwaambia, what is it that you tell them in a language enye wataelewa? Because again, like we said, up until now, not so many people really understand, about sickle cell. So unawambia ngaje, like at least waelewe, ndio hata the next time wakiona you're in pain in class, wanajua, oh, si ati anajifanya, ni ukweli he's in pain.
So mi waambia actually mostly that mi waambia in a specific way denyo atajua kitu yenye mtu ukiambia mtu mwingine ataambia. Naambia mi explainia hata nikuwa na pencil na kitabu, naambia so unaona red blood cell yako ni iko circle.
Yes.
Sa mimi niko na different red blood cells, anasema aje. And then tena anachora the
the sickle.
Yes. Naambia sasa yangu kwa capillary kwa nini haipiti, but yako inapita vizuri. Sa yangu ikienda ikwame, ishikane hapo, yangu inaniletea crisis, na yako inaweza flow vizuri. Sasa ukipatikana na crisis, nashikwa na pain hapo pali hiyo blockage itakuwa, nitashikwa na pain hapo. So unaona anaelewa, nasema enye. So hapo sasa pia imenisaidia juu sasa si ati kila mtu atanichongoa sasa. Hata kani wengine, but
it's because they don't know. Na unatumia hiyo opportunity kwa explain. That is really nice. You're doing so well. I like that. That is really, really nice.
So explainia wengine hata nikifate class ama ni collapse, utaona tu wenye lili explainia na enye huyu ajifanyi, acha tumkimbize.
Yes. Yeah. Okay. That's really nice to hear. And you're advocating, which is really nice. Wewe endelea hivyo, tutakunini utakuwa ambassador wa because again you're explaining in a way that they can understand, right? Which is really, really good to hear. From again a caregiver's perspective, she talked about how, again, even from the healthcare system, sometimes it's not even understood, and unatumwa from point A to point B to point C, but still, and that also happened to you up until ulipata that diagnosis. Aside from that, what is the most difficult part about being a caregiver?
The most difficult part ni wakati hao jamaa wako na pain. Wakati hao watu wako na pain, like hata akili haifanyi kazi. And we also learned that when akona pain, kuna hiyo time watu wana breakdown, but hata kuna breakdown where utaingia wash tu mama na huko ama utoke nje, ulie yako kwanza ndio urudi. Ndio ukikuja ndio ukirudi kwa mali unampatia, you give him courage, you give him courage. Alafu with with Wesley, I see him, namuonanga kama he's our symbol of hope. Because huyu in 2023 he had a mild stroke. Actually ilikuja design, he wiped his memory clean, hajui anything, hajui mtu yoyote, alikuwa tu dunia yake. He survived from that. He came back, akaenda surgery, splenectomy, katolewa nini, he came back. So hata vile tulikuja kulana, by the way, tulidiscover yake tulidiscover akiwa 8 months. So yeye ndio tulimwambia at 5 years, because at 5 years alikuwa chapter alikuwa anaweza ongea. So akasurvive hiyo nini. So tuli decide now, kukana yeye, tukakuwa kwanza we become best friends. Naambia sasa hii kitu sio yako peke yako. Then with the diet. And that is also a part which is very heavy, because when it comes to their diet is special. Their drugs, hiyo nao tulipambana nayo mpaka unapata hii pesa inaenda kwa dawa. Ukipata hii ako ward, amelala wiki 2 wiki. So zile times wako na crisis inakuanga mzito sana. And that is why I decided that, okay, with my position in the society, kama kioo, I decided wacha nikuwe ambassador, so that hii kitu, because so many people wanaiogopa. If you go to talk to people, mention the word sickle cell, we went to perform somewhere. And ilikuwa kwa church. I told wale tulikuwa now that, because we are performing in a church, it's good I also share that I'm a caregiver to mtoto akona sickle cell. Hapana, you usimention hapa, you usimention hapa. It's like ukisema people will run away, you know. And I felt, you know, time nilianza kufeel kwani ni curse.
You know, like,
yeah. But nikakuja kuelewa that people don't know it, and that is why nikamua I want to be an ambassador so that I make noise about sickle cell, watu wajue that it's not contagious. Yeah. And even with sickle cell you can live your normal life despite the challenges. You can live your normal life. Again, me coming from a family of 11, sisi mimi namba 5.
Okay.
Hao wengine wote hakuja kuwa na kesi ya sickle cell. So when it was diagnosed, tukarudi kuambia nikajaribu kuuliza sasa mother, do you know of this history? Alisema hiyo sisi hata hatujawahi.
Hiyo hata si.
And I went back kwa doki nikamwambia, how come sisi tuko watu 11, hakuna mtu yote akona hii shida? My mom nimemuuliza, kwao wanasema hawajawahi sikia. Kwa kina wife hakuna kitu kama hiyo. So inakuaje? Doki akaniambia iko hata kama maybe hauko, but walikuwa maybe trades too. But sasa imekuja kulipukia kwenyu. And in fact it went on that way. And I still believe that my family had a difficult time kukubali until a brother of mdogo wangu pia alipata mtoto ambaye is also a sickler. You know, so it becomes very hard to explain ya watu wanashindwa, you know. At some point, do you know, people think that ama bibi umeoa ndiye amekuja na ile ana.
There's always
because
that.
Kuna hizo thoughts. So it's about, you know, ni kitu ambaye nafaa ipigiwe kelele, watu waijue zaidi, kukuwe na a lot of sensitization, ndio tupunguze mpaka stigma, especially kwa hawa wako shule and all that.
And let me tell you, I've had that, you know, when you're saying mtu anasema we bwangalia huyu bibi maybe wamekuja ni ama tumerogwa, mtoto wetu aliangaliwa na macho mbaya, you know, all those things that the society will try and blame, you know, and not really look at, maybe ebo cha tuangalie familia yetu, you know, kwa history maybe kuna hiyo, you know, kuna trace, maybe kulikuwa na career and what not. I want to hear from you, lakini tunaenda break. Si tuchukue break and then we recover, because during break I remember ulikuwa unasema kuna singine ulilala kama mkono iko hivi juu. Juu ya paid, and then we'll also look at management. What exactly does management look like? Yes, sorry? Was saying, okay, sawa. And also just remember, we're asking you, what question do you have as far as sickle cell is concerned? We have warriors here, we have caregivers as well, and also we'll be joined by a doctor as well to give us more information on the same. But hey, keep sending in your questions. That is at NTV Kenya across all board. Use our WhatsApp number 0112 500 400, or better yet, give us a call, okay? We'll see you after the break. Do stay with us. The show is your world. All right, welcome back. Officially the second hour of the conversation today, right here on Wellness Wednesday on Your World. And we're looking at sickle cell disease, and we're actually speaking to warriors as well as caregivers. And now we are joined by Dr. Doreen, who is joining us virtually. Dr. Doreen Karimi, thank you so much, Dr. for making the time. I know it's like a busy day for you. But really, thank you so much for making the time. So first question would be sickle cell disease, because we hear sickle cell disease and sickle cell, you know, anemia. So just help us understand that sickle cell disease and sickle cell, you know, anemia. And tell us where you are.
All right, so thank you very much for inviting me today. This is a wonderful month for sickle cell. We take this opportunity to raise a lot of awareness about sickle cell. My name is Dr. Doreen Mutua. I am a pediatric hematologist, oncologist at Gertrude's Children's Hospital. And now on to your question. Sickle cell disease is actually a broader term. So when you say sickle cell anemia, it actually means one type of specific sickle cell, that is hemoglobin SS. But there are various other forms of sickle cell, and we have sickle cell in combination with other diseases we call hemoglobinopathies. So, for example, you can have somebody who has sickle cell and thalassemia, or you can have sickle cell HBS and HBC, HBS and HBD, HBS and HBO. So all of these are lumped in together, including sickle cell anemia, into sickle cell disease. So sickle cell disease is a broader term.
Okay, all right, and just to help people really understand the disease part of it, because again, when we started the conversation with warriors and caregivers, most of the things that they said, first of all, is the crisis, pain and crisis. So for someone who is really struggling to understand the disease aspect of it and what brings about the disease, because you said it's a broad term that just can be narrowed down to the disease part.
All right. So really, sickle cell is a very old disease. The first patient was sort of diagnosed, or they put a disease to their symptoms around 110 years ago. Basically, what happens with sickle cell, the red blood cell is actually supposed to be like a donut. Right in the middle of the donut is where the oxygen is carried. So red blood cells carry oxygen. Now, in sickle cell disease, they do have a mutation that changes the shape of the red blood cell from looking like a donut to actually a sickle or a crescent. And that's why it was called sickle cell disease. Now, unfortunately, when it's like a donut, it's able to move through the blood vessels. But when it changes shape to a sickle, then that red blood cell is not able to move freely through the small blood vessels in the body. And remember, when then they get to a point that the blood vessel is too small, what will happen is the sickle cells obstruct the flow of blood to the organs or the tissues they were carrying oxygen for. Now, the only way your body will tell you that I don't have enough oxygen, it actually causes something called pain. And it is that pain a lot of our patients with sickle cell disease tend to present with. And they'll come in and say, oh, my hand is hurting. But the reason that it's hurting is because that part of the tissue has lacked enough oxygen because of the obstruction by the sickled red blood cells.
And at what point then do we see the disease then detected? Because from what we've had from the conversation, there's some people, theirs was detected at 8 months, another one at 2 months, and sometimes some people don't know until, say, like in the later, years, either the preteens or teenagehood or even into adulthood. So at what point is it mostly detected?
Yes, so that is a very good question. And this is because for our health system, we wait for our patients to come in with symptoms, then we test them for sickle cell disease. But that's not the way it should be. The best way to detect sickle cell is right after they are born. And we do something called newborn screening. And you're able to tell who has sickle cell disease, who is the carrier of the disease, and who is actually normal. But be it as it may, in Kenya, we wait for our patients to come in, and when they have symptoms, and what symptoms would you see? A lot of them will come in and they just have these recurrent body pains. They come in one time, it's a joint, it's swollen. For the little ones, it's their hands and feet that swell. Others, it will be, oh, my back is hurting, my leg is hurting, oh, my shoulder is hurting. And because of that, if sometimes, because we know some regions tend to have a higher prevalence of sickle cell, then if you're keen and you have a high index of suspicion, then you might want to think about sickle cell disease. Now, a lot of the other patients are picked up because they come in and they're looking pale, and that would be that you actually look into their hands, and instead of looking pink or red, they actually look white. And if you look under their tongue or under the eyes and you look into the eyelid, it looks much paler than it would be. And then you might see a yellow pigment in their eyes, and that is what we call jaundice. So most of the time, if you see anemia, jaundice, and a patient who keeps coming in with painful crisis, then that would really push you to start looking out for testing for sickle cell anemia.
All right.
There is one blood test that we can also do quickly. That's a hemogram. And usually with a hemogram, then once you'll see the anemia, and then you'll be able to pick it out.
All right. And you also talked about carrier, but we also hear sickle cell trait as well. So do you want to just explain that to us, the carrier part, the trait part, and then we've talked about the disease part. But yes, trait and you know, when we say someone is a carrier, what exactly does that mean? And how do I know that, say, I am a carrier?
So actually, a carrier is just that. They carry the sickle cell gene, but they don't have the disease.
Okay.
So remember, sickle cell is inherited as what we would say in medical terms, autosomal recessive disease. That means you have to get one sickle cell gene from your mother. You also have to get another sickle cell gene from your father. When you have two sickle cell genes, then that makes you a HBSS. Or if you have a sickle cell gene and anything else that is not normal, that's thalassemia or HBC or HB, anything else that is not normal plus sickle cell, then you automatically have sickle cell disease. Now, for somebody who is a carrier, what they have is that they have only one sickle cell gene. When you have one sickle cell gene, then you don't have enough to manifest the disease. But what that tells you, that you have the ability to give that gene to your children. And that's why they're called, they're carriers of the gene. Now, because of that, and that's why newborn screening is extremely important, is that most patients who have, or most people who have the sickle cell gene or traits actually have no symptoms. And the first thing they ever get to know that they even carry the sickle cell gene is when they have their child diagnosed to have sickle cell disease or sickle cell anemia. So the best way is, because these carriers might never know, test them as soon as they're born, know their sickle cell status, so that then when they get married and want to have children, they can have their children also screened really early to be able to know if they have sickle cell disease.
I mean, and I'm happy that you're talking about marriage and having kids, and also, you know, you talked about, you know, having kids, because for a very long time there has been a lot of conversation about, can I get married? Can I still get kids? And if I get kids, will they have the disease? It's a whole lot, which again, we'll talk to you about in a second. But the other question would be, so you talked about, sadly here in the country, we wait until a patient, you know, comes to the hospital, or a parent brings the child to a hospital. But are we then doing screenings now? Do we have that capacity to do, you know, screenings either before a baby is born? Do we have that capacity now?
Actually, we do have the capacity. What we haven't been able to do is to have it anchored in policy and then push it off to practice. So for newborn screening to actually be effective, we need to have every child born in Kenya actually screened at the time of birth. So that requires, because that would mean public hospitals, private hospitals, everyone who has a maternity ward, soon as a child is born, then they are. And for those who are probably born at home, then as soon as they come in for their 6 weeks vaccine, then we test them as soon as possible. In terms of sickle cell testing, yes, we do have the ability. We have from point of care testing, which means you come in and I suspect you have sickle cell, and within about 20 minutes, I do a test and it's able to tell you whether you could be a patient who has sickle cell disease, or all the way to confirmation. We have all that technology and the ability to make a diagnosis of sickle cell. But the only thing is, it must, you know, a doctor always orders tests based on what they're thinking. So that means you have to be in the presence of a doctor who suspects you could have sickle cell, and then they order for the test.
Okay, so it's more of on a need basis. But again, how many people would,
But actually, that is not the most efficient way to do it. We should be testing all our patients really from birth. But even then, I keep saying, let us all have a high index of suspicion and make sure that we truly test our patients as soon as possible. And if there has been a family member who has sickle cell disease, I know a lot of people, when they have their children diagnosed, they want to put it, what I say, they want to hide it under the carpet. They never tell even their relatives that we have sickle cell disease. But please, if you have sickle cell in your family, tell your relatives so that then they can have their children tested as early as possible.
Well. Yeah. All right, Dr. Please stay on the line because we still have so many questions for you. But I know one of the most common questions that people would ask is, number one, is it treatable? Is it curable? So please stay on the line because we still have so many questions for you. But I see you want to say something?
Yeah, the doctor, because I have friends who are carriers, but they still have sickle cell pains.
Okay.
Yeah.
All right. Okay, Doc, did you get that? So you have friends who are carriers, but they still have
the sickle cell pain. They experience the sickle cell crisis like us. And also they really go through like the everything we feel, they feel too.
Oh, interesting.
Yeah.
Okay. Doc, what does that mean?
Yeah, so sometimes I do get that. Somebody says, oh, I was tested, I was told I'm a trait, but I still do occasionally have pains. How is it? And most of our patients shouldn't have. So yes, sometimes we do see some patients who are traits having, but those are the very, very, very few. And sometimes if they're really having pain consistently, I would really request maybe they see an expert like a hematologist and maybe have their test repeated and we see if truly they are traits.
Okay. All right. We also have a question for you on our WhatsApp number 0112 500 400. So let's see the question and then have Dr. answer. So this one says, hello, your world. I have a question. Why is it that sickle cell is more susceptible in Western and Nyanza regions? Okay, Dr.
Oh, that's a fantastic question. And because sickle cell mutation was a way to adapt in malaria dense areas. So if you carry the sickle cell gene, that if you're a trait, you're able to actually survive in malaria endemic zones. But unfortunately, as we said, most traits will never know they carry the sickle cell gene, so they will survive the malaria. But then if they marry another trait, then they end up with a child who has sickle cell disease. So when they get a child with sickle cell disease, then the challenge is that most likely that child who has sickle cell disease and somebody who has a normal hemoglobin become now susceptible to malaria. So you're very right. We find it in malaria endemic zones, and that was because it's an adaptation to be able to actually be in a malaria endemic zone.
Okay. All right. So we'll have more questions for you, Dr. But I know you wanted to say something in regards to, again, caregiving and the most difficult part of that. And then we'll also talk about management, and diet as well. I know earlier you said, listen, drink your water, drink water and hydrate. But yes, aside from that, but yes, go ahead.
Thank you. I wanted to add on what Lawrence was saying about after diagnosis with family members and spouses. Now, most of the time it feels like most of the people thinks that it's a curse. And in our African setup, when you're in a marriage, mostly everything bad comes from the mother's side.
Unfortunately, so, I don't understand why, but
everything is pinned on the mother's side. Hii is ya kwetu haiko. We have never seen this. So this is one thing that is really affecting marriages. It is really affecting most families that have sickle cell children, and it's something that should be really addressed because in most cases, most mothers with sickle cell children are single parents. And this is because awareness and sensitization is normally done, even in the support groups. Most of the members are ladies and women. Men are not there. In my case, I'll say that my spouse has been very supportive. I applaud him for that, and I thank him for that. And in some families, men always leave the group. They left the group the moment the child has been diagnosed with sickle cell disease. And this is something that should not happen. The diagnosis has already been done. let us sit together, discuss this as a family. How are we going to do it? How are we going to manage it? If it is going to the clinics, let's walk together to the clinic. And the matters about medication. Sometimes I feel like we are here in Nairobi and sometimes I can't even afford that hydroxyurea. I feel about that person back in my village who has the same condition. What happens to them? How are they surviving? And at this point, before we used to use NHIF, at this point I don't want to say anything about SHA because for me, I just feel like it is failing us, especially those people living with chronic diseases. It is really failing us. And out-of-pocket expenditure is becoming so high.
I can imagine. I can only imagine because when you have, to have to use it, is it every day? Every day. How many times in a day do you have to take meds?
It depends. It depends.
Okay.
Some take 4 hydroxyurea per day, others take 3, others take 2. But again, Dr. Karimi can explain, because what happens is you'll find that you're given hydroxyurea according to your age, your weight.
Okay.
And then also how frequent do you get your crisis?
Your crisis. I see that. Genius said that
men lefting.
Lefting the group.
Actually, I wanted to say I applaud Lauren for being here and standing here.
You know, the reason maybe I can understand because at some point I felt like, you know, lefting the group because with sickle cell it's not like this is about like, you know, I'm sick now, then I'll get well, then after some months then tena turudi pale. With sickle cell there was a time, actually it was a whole term which is 3 months. Huyo alikuwa mgonjwa, yani ako chini 3 good months for a whole time hakwenda shule when he was in primary, I think class 6 or 7 hapo. So it comes to a point ambapo I think wanaume pale tunarudi pale kwa mental health. It really affects the men. Now wanaume, me actually I applaud my wife kwa sababu if it were not for her kunipatia hiyo encouragement kwanza, kunionyesha that we are in this together. Ningekuwa nimeleft kitambo. Because haupati watu wanakupatia like in terms of mental health support because this thing inakoroganga mtu. Me at some point nili fall into depression because of this nini. Then you become a burden. People start seeing you as a burden. Hata kwa job watu wanaanza kuona as a burden. Watu wanaanza kuona wewe uko na mahitaji mingi, wewe utakuja hapa kesho uanze kutuambia sijui mtoto ni mgonjwa. And then people don't understand. Someone told me that Kokoto we kwani wewe unashindanga mtoto wako ni mgonjwa tarehe moja. And saa hiyo hawajui what you are going through. So even for as we do the sensitizations and awareness, lazima pia the boy child tuangaliwe at least kwa tunaweza pata hiyo the mental health support because it is too much. Na wale wana left unapata ilifika mahali because unaona ni leo ni hivi hatukulala kesho hivyo, na inataka kuendelea like that for a whole month or 2 weeks or 3 weeks. Inakuwa too much. So you can left. Unaweza ondokea.
But then again what you're saying is support is very important because you can imagine you as a caregiver feeling like lefting the group. Imagine the person who's going through that crisis and feeling that it's like you feel like leaving your body, but now you can't leave your body, right? Because sometimes the pain it's too much based on what you guys are saying. Genius, I wanted to hear from you, you know, as well, in terms of when did you get your diagnosis? How is it like for you living with sickle cell? What are some of the things that maybe you're not able to do, you want to do, you know, crisis, you know, the whole 9 yards? And we have like 3 minutes to go on a break.
So we go first.
No. You go, but speak closer to the mic, yes.
Okay, for me first, I'd like to for Kokoto, that's a salute for him. For in my life nimeona wanaume wawili I had my dad watatu wenye like they're taking care of their kids.
Yeah.
Like hospitali, mama yake hayuko ni baba yake yako. Yeah, like for me, like if I'm sick, I'll go tell my dad like nasikia kifua. My dad will just be like vaa kiatu.
Tuende.
Iko wapi kiatu yako? Tuende. And the nurses are like, oh, Nunda umefika? Daddy yako wapi? So there's this nurse called Kista. I'm like I'm like in my 24 years, and like she's like, Nunda sijaiona mama yako. Mama yako ako wapi? But then mimi na mama yangu tuliachana kitambo. Oh, she's alive. Nile tu tuli.
Yeah, okay. Life happened.
Yeah. Like nikipata people who have sickle cell male boys, but ako like 18 and above, utapata ni watoto wa mama.
Okay.
Like the mommy's boy, hivyo. But then no kweli, like onadekezwa ile sitaki kuona na huyo, sitaki kuona na huyo.
Is it because mama ameona hiyo uchungu umepitia, you know, all the, so they just want to, you know, yeah, like you're my baby, you're my child, no?
It's true.
Right?
There's a way you get so
attached. Anataka kuuliza wewe ni mama's boy, wewe ni mama's boy. Yeah.
Their dads.
Right?
It's not a good thing.
He's saying it's not a good thing. Okay, we're trying to break it. Then when we come back, we'll address more on that, and then also hear from you, you know, as well. But yes, the question that we're asking you today is, what do you want to know? What question do you have as far as sickle cell disease is concerned? So watch us just watu wa WhatsApp wanasema nini? The number is 0112 500 400. Okay. Okay, so this is, yeah, I think Daktari answered this question. Okay, but someone else. Okay, great. And then this one says, hello, Pius, watching sickle cell disease, Nairobi, patient, hemophilia, advocate. We are niwewe. Okay. And then says, how does the patient supported through medication, care for improved care and advocacy for better management and not just use patients for data? Okay, Eunice, I'll also want to hear from you as well in terms of like, you know, management, data and all those things. But also Dr. Doreen as well, we have so many questions for you and keep sending them our way, and that is at NTV Kenya across all board. We'll forward them to Dr. and also the warriors and caregivers that we have here on set. So we're learning a lot together on the show. Don't go too far. We'll be right back after the break. All right, welcome back officially in the last few minutes of the conversation today as far as sickle cell disease is concerned. And we're learning so much from the conversation today. And I really hope that you're also learning so much. But like he said, what question do you have? That is the question that we're asking you today. What question do you have as far as sickle cell disease is concerned? What is it that you want to ask today? We have Dr. Doreen still with us, joining us virtually to answer all your questions, as well as the warriors that we have on set today, and as well as the caregivers. So what question do you want to ask as far as sickle cell disease is concerned? So there's one here who asks, one second, let me get it. So someone's, this is Mato Kamuna, who asks, how many years do they exist? Okay, so Dr. I think that's a question for you. And then another one says, any removal of this sickle and the total cost, which hospital is recommended for the removal procedure? That is, if technology has caught up with the disease. So I think, Doc, those are two questions for you. First of all, the removal part, okay, Dr. you answer.
So thank you very much for the questions. And let me say, because I'm a Kenyan, I understand your context and do identify, yes, that we have had quite a bit of a challenge in managing sickle cell disease. But patients with sickle cell can actually live a very, very long life. For any chronic illness, it is pegged to the care that they receive. And that is why we are advocating that we have newborn screening so that we can get our children with sickle cell disease as early as possible and introduce them to something we call comprehensive care. And right there, I was hearing lots of comments about mental health and the psychology and a lot of issues that come, especially when you are having a chronic disease. I promise you, it's not only new to sickle cell. Even other patients who have autoimmune diseases like lupus or have kidney disease or they have diabetes, every step of the way, it affects you. Anytime you have to keep going to hospital and you have to keep getting blood tests, you have to maybe go in for an inpatient admission more than other people. And it also does affect you. It affects how you even think about longevity, like those questions of, oh, will I live? How long will I live? And I say you can live a very long time. And it's true. I have seen like one of my patients, they have a grandfather who is now in his 70s, and not only as in his 70s, a great-grandfather, but also has sickle cell disease and is a cardiothoracic surgeon. And I say, look at that. He could do everything. He has lived his life. He's had seen up to his 4th generation, and he has even gone into being a doctor, which is very difficult, and even gone to be a surgeon who takes care of the heart. So I think the life of all people with sickle cell is unlimited. What we need to peg it on is proper care of that sickle cell disease, and that brings in now all that holistic care that I talk about. It's not about the medicines. It's also all the issues that we talk about, nutrition, about the immunization practices that they need to have, about the psychosocial. And it starts from the time we make the diagnosis. Hold those two parents together. First, make sure you tell them that this disease does not come from one side. It's not mama's problem. It's both of them who carry the gene, and that's how they are able to have a child with sickle cell disease. Make sure they understand it. Take them step by step. And then all along through treatment is to keep being aware as a doctor that they will have moments. They'll have moments where they break down. They'll hear a word in school, oh, these patients don't survive. And they'll come in and they're all mushy and having issues and they're having quite a bit. Support that. So you need to have your psychosocial team on board. Then onto hydroxyurea, and I know from the conversation before, it was mentioned, and really hydroxyurea is the standard of care. What we have issues with in Kenya and in sub-Saharan Africa is access to hydroxyurea. I promise that drug has really changed the outcome of many, many patients with sickle cell disease. And I say with just hydroxyurea, we can be able to take care of a lot of our patients. Now, other than managing, because sickle cell is inherited, it's a chronic disease, so we manage it with medication and all these other things that we're doing. But now, we are also looking into how can we be able to cure sickle cell? And that goes to the second question. Yes, we can cure sickle cell, and that can be done through a bone marrow transplant or gene therapy. Now, bone marrow transplant has been in existence specifically for sickle cell disease from 1984. That's when the first patient with sickle cell disease was cured with a bone marrow transplant. And all along now we've been able to actually almost perfect the art of doing a transplant in sickle cell disease, and happy to tell you that now we are also having that service even here in Kenya, and that's where Gertrude's Children's Hospital has actually put up the first pediatric bone marrow transplant unit, and hopefully most of our patients who have sickle cell disease and have an indication for bone marrow transplant can then be brought in, screened, we select a donor and be able to take them through that process. Now for gene therapy, what that happens is that we take the patient's stem cells, we harvest them, take them to a lab, we remove the sickle cell gene, put the right gene right there, and bring back the stem cells back to the patient, and we infuse them. And once they infuse, then the new stem cells take over and they are cured of sickle cell disease. That's a very simplistic way of saying it. For now, the Food, Drug and Administration has only approved gene therapy for children from the age of 12. It's still happening a lot in the clinical trial setting, and it's still very expensive. Anywhere you could think about it from the range of 50 million and above. So it's still not accessible to most of our patients. But yes, transplant is here. It's fairly getting more and more affordable. And I think it's for us to keep lobbying so that our patients can have access to such life-saving treatment.
I mean, yeah, my jaw dropped when you said 50 million, because again, the question is how many people are able to, you know, access that or afford that? And the next question would be then, so what is it that we need to do to at least bring the cost down? Because there's so many people who need it and would wish to have it, but then again, you know, cost will be a bit of an issue. So yes, you'll answer that together with these other questions that we have for you on WhatsApp number 0112 500 400. So let's take a look at some of those questions that we have for Daktari as far as sickle cell is concerned. All right, there we have it. So this one says, okay, so this one says, hello nation, how can we develop safer, more accessible and universally applicable curative therapies such as gene editing and improved stem cell transplants to eliminate the disease burden for the vast majority of patients worldwide, and especially in low-income regions where it is most prevalent? I think, yeah, this person just asked the same question I did. When this one says, hello NTV, this is Eunice. I wanted to find out whether there is a possibility of sickle cell disease disappearing at some point in life. My son was put on sickle cell disease drugs for months, only to be told later by a different doctor that he doubted whether it was really sickle cell disease because the HB was consistently high. Okay, Doctor, I hope you've noted that. And then, wow, okay, this is a long one. All right, can we scroll up so that we see? So this one says, hi, I am Barak Samuel from Kodera. I am a Form 2 student who is suffering from sickle cell anemia, and I did my best in my KCPE exams and managed to join Agorosari High School. But I was transferred to a day school because I was becoming sick and mostly out of school. But my mom was against that decision, which was made by my brother, who's a teacher at that day school. And it was also nice to me by that decision. But after me attending that day school, I started having complications because of the situation I had encountered. Like my home to that day school is 5 kilometers, and because of my situation, I can't walk to school. So my mom, who was also sick, heard that I transferred to day school, and she did her best and employed a motorist to take me to school and back. But the problem is that the roads sometimes are impossible. So I just need to walk from school if I went in the morning and then trained in the evening. So I walk from school. Tomorrow I may become sick and have more complications than than my normal sickness. Like for now, my gallbladder has sludge, and lately, and my lower skin mouth becomes damp, maybe numb. That's what they meant. And I was told that they are because of cold and environment that I live. Currently, my mom cannot afford my transport because it's more expensive than I was boarding at Agorosari High School. And the health complications I am facing right now, my brother doesn't understand my situation at all cost and can't even support my mom financially. My mom went back to request permission at Agorosari High School for me to go back and finish my education, but they refused even to hear my situation, and they just said that there is no chance at that school again. Currently, I'm at home. My mom is trying all the best she can. Then my brother is against it. So it's like it has made them not to be having their bond again. I just feel like I am a problem at our family. I am just tired. Eunice, I think you'll speak to them, right? Okay, and then this one says, good morning. I am Wamin from Eldoret. Just want to know if one suffering from sickle cell cannot give birth. I think that's a question for Daktari, and also I'd want you to answer that. Then this one says, good morning NTV. I am Hafswa and I am a parent. So if you were once married to your partner and later finding your kids as sicklers, is it true now that you are advised to separate or not having kids again? Okay. And then this one says, ask the doctor about the patient with sickle cell disease who is 70, whether he gets transfusions. Okay, Doctor, I hope you've noted that. And then this one says, hello, I am Mary Akinyi, counseling psychologist, mental health advocate, life coach, and a career counselor. And I am enjoying and learning a lot on today's conversation. I would love people to know that I am here to offer emotional and psychological support to anyone, parents, caregivers, or warriors who may be struggling. You can find me at Amut Healthcare Center, Mountain View, Wayaki Way behind Total Petrol Station, or reach out on 0113366548. You don't have to walk the journey alone. Support is here for you. Thank you so much, Mary. And I really hope we can get the one from Kisumu, the student, to also get in touch with Akinyi as well, because, yeah, he needs that mental health support. And then this one says, hello, I am Maxwell Hunja, just asking about gene editing advancements and pricing right here in the country. All right, Dr. I don't know how much of that you noted. Video all these questions, and then we'll also have you do the Yeah.
Yes, so thank you very much. Those are all very good questions.
Good questions,
and,
yes.
Trust me, even at the clinic, I do get a lot of those questions. And yes, to the person who asked about the new doctor who is actually thinking that this child might not have sickle cell disease, I would really go back and say, check into how you are diagnosed. I always say diagnosis is the first thing, because if you board a matatu going to Kisumu and you wanted to go to Mombasa, you'll never get to Mombasa. You need to really be sure where you're starting from. But then, yes, it does happen, even in my own patients, that we put them on hydroxyurea and their hemoglobin levels actually go back to normal. They don't have pain crisis, they don't need transfusions. In fact, they just come from one clinic to the other, having had no issues. And sometimes even the parents start doubting whether this really diagnosis exists. And I say, yes, it is. If you stop the hydroxyurea, you go back and have your symptoms. So if the diagnosis is right, then you're a good responder to hydroxyurea. Keep up with it, keep up with your clinics, don't stop, you're doing very well. Now, about having children, yes, it's okay if two people know that either they carry the sickle cell gene, and what they need to decide is if they want children or not. So you can never really determine who loves who. And if they want to get married. And then the other next choice is, do they want children? If they do want children, remember, it's not all children who are born to people who are carriers of the disease who will have sickle cell. Out of 100%, only 25% will have 25% chance of getting a child with sickle cell. So 75% chance they can either be either a carrier or normal. So you still tell them it's a choice. They just need to be informed that they carry the sickle cell gene and have their children tested as early as possible. And the risk or the chance of having a child with sickle cell is only 25% for every pregnancy.
Okay.
That does not mean you should separate a family. In fact, as you had, you need that family support. You need the father, the mother, you need the siblings, everybody on board to be able to take care of each other. So we don't advise you to separate families or to separate couples. No, let them be informed they carry the gene and they make other decisions with the knowledge that they have.
Okay.
Now, about the young man who is really struggling with school, I feel you, I hear you, and I can tell that school is very at the heart of what you are as a person, and that's very important. And what I think you need, and I'm happy somebody has called in as a counselor, I think is for us to look into how we can be able to integrate you back to school. Might be not the boarding, but can we look for a school that is much closer? Because yes, if you have to walk 5 kilometers, even for a normal person, it's actually quite tiresome. And especially if you're not hydrating very well, then that will push you to getting more and more crises. Also, boarding school, I have a number of my patients who are still in boarding school. What is very important is you must know how to take care of yourself, take your medicines, remember to take them every day. And we work with the teachers, and that's another aspect of children, because most children, 80% of their life is actually in school. So we need to teach teachers how to help our patients with sickle cell disease so that they're able to have a good quality education. Because sickle cell is not a limitation. Their brains are extremely intelligent. They can be able to go to school, learn, get a career, and move on. And yes, the person the doctor, the cardiothoracic surgeon who is 70 and above, has really not had many transfusions because he was also a very good responder to hydroxyurea and has lived a very good quality of life. Because you remember, you also have to have all these other comprehensive care aspects of sickle cell, like the screening of your organs, and he goes for that and goes back. And actually, he shares his story openly and goes back to give hope to many, many people.
Yeah.
So I think about the gene editing, yes, as we speak, gene editing is still experimental, and that's why it is still very expensive. Because the people who have developed that technology have to reap from their invention. But hopefully in the future, I think it's bright, and it means it's a technology that we can tap into. And as we keep advocating for our patients and pushing that they may get also access to such life-saving treatment, then it may get cheaper and cheaper in future. But for now, bone marrow transplant is accessible, and it's slightly cheaper to be able to have a transplant than gene editing for now.
I see. Thanks, Doc, for those answers. And please stay with us, because we'll come to you then to take your passing shot, because we only have 5 minutes and want to hear from you guys in terms of, so we've understand, first of all, cost of treatment is expensive. Even bigger concern is data. We don't have data up until now. So then moving forward, you know, what is it? What conversations, what is it that we want to see as far as where we are as a country, as a community, as a people, as families when it comes to sickle cell disease? I want to hear from someone who hasn't spoken, and please be very brief, like 45 seconds, and then we'll come in here. Yes, and yes, what is it that you'd want to see different in conversations, and just a little bit about your stories?
For what I want to see different, as long as unajua watu wanajua blood groups zao, mini O, mini B, I want people to know their genotypes.
Okay.
So when people go to the hospitals, waambiwe genotypes zao. Mimi ni AA, AS, SS. So to avoid the diagnosis part. Okay. Unaenda waambiwe mtoto wako kuna sickle cell, ama ni trait. So we want to avoid that. And for my journey, mimi sijapitia sickle cell hivyo sana.
Okay.
Because nime observe from my sister. So mimi ward sijakuwa ward sana mimi. Not sijapata transfusions, nothing else.
Okay.
But my sister is a mother. Hizo rumors za sickle cell warriors cannot have children, zote ni lies. Yes, sicklers have low HB. I don't like to call us sicklers.
Warriors.
So, warriors.
Yes.
Tuko na low HB. The maximum we have, it's around 8. But that's good. Inaweza beba damu kila mara.
What is it that you do? Because then, like you said, so Japata transfusions, crisis peer, not so much. What is it that you do that you would say has helped you? Is it your diet? Is it, sometimes someone will say attitude, sometimes just staying positive and just maintaining positive attitude also helps. So what is it that you do that maybe you'd want to pass on to people who are watching us at home?
Niko na ego.
Niko na ego. Okay. Okay.
Mi nasemanga I don't have sickle cell kuna mimi. So niyo ndo nanifuata.
Okay. So like I don't own it, it's not mine, but okay. That's a good way to look at it. That's a good way. So you say like your attitude has sort of like helped you, you know, thus far. I like that, and thanks for sharing, you know, that. Okay. Do you want to say something as well? Okay, uko tu sawa. Okay, all right. Yes, let's hear from you, Wesley, because you're doing so well in terms of advocating, not just for yourself, but also teaching people about sickle cell disease. So what is it that you'd want to tell the people who are watching us at home, whether it's, you know, teenagers come away, whether it's parents, whether it's schools as well, because you are in school, and even Gava, you know, if they're watching us this morning, what is it that you'd like to tell them?
Mi kitu naweza taka kuambia ni that kwanza watu wenye wako na sickle cell, that any kind of pain yenye utapitia ama pali uko sahi hata kama uko na crisis, just kuwa na positive thought na ujue you continue living. Yes, kuna wale watu watakuangusha hopes, but you still pushing.
Yes.
Na utaendelea tuku kwa mkubwa.
Yeah.
Yes.
I like that. I really like that. Okay. All right. Do you want to speak on behalf of the parents, or you have something else to say in like 10 seconds?
Okay.
Okay, go.
Ningependa kuambia Wesley, mimi nimesoma Langata High, boarding, throughout Form 1 to Form 4.
Okay.
Uhitaji watu wengi. You just need 2 people, 3, wale unatembea na wale unajua, ride or die.
In your circle.
So only those. utaenda mbele.
Takwa sawa. Thanks, that's good advice. Okay, in like 30 seconds, do you want to speak on behalf of the parents or also speak to the parents, and especially wale on a left group, the dads?
Isikuwe that kama mtoto wako ama you have someone ambaye akona sickle cell, don't be negative, just think positive, and it is upon sisi kama caregivers kukua the wa kwanza kuwapea hope.
Okay.
If we start by giving them hope, sisi wenyewe tutajipatia hope, and it will just spread all over.
Yeah.
And that is why
Yes.
this weekend we are having a sickle cell charity match.
Yay.
Yes, Atuchali.
Okay.
Ambayo imekuwa organized na Children Sickle Cell Foundation. So watu pia mkuje pale. You meet the caregivers, you meet the patients, you hear our stories hapa kwa hapa, and we learn more about sickle cell.
And we learn together.
Yes.
Okay. Eunice, will you speak
just also to tell people that yes, we do have a Sickle Cell Federation of Kenya, which brings all the sickle cell organizations together. And actually through the federation, we are also pushing the Ministry of Health to be able now to collect the data that is needed together with the we call them the necessary things that we need as patients.
Yes.
And the way Doc said, hydroxyurea, I call it a wonder drug.
Yes.
Reason being, it's only sickle cell patients that have fetal hemoglobin, which most of us lose it at the age of 6 months. But for us, we stay with it until the day we'll die. Because of hydroxyurea, that's what now helps make the hemoglobin even to go higher.
Okay.
And also you avoid getting crisis a lot. So we tell you today the way majority of them has said, know your status, know your sickle cell status. It is very important. And you can follow us in our social media, Sickle Cell Federation of Kenya. You'll find all the organization like Children's Sickle Cell Foundation, Sickle Cell Uhuru Trust, Sickle Cell. There are so many groups.
So many of those,
And something else I need to touch.
We have to go. We gotta go. We gotta go.
Diet.
Yeah.
He talks about diet.
Yeah.
But sometimes people in the rural areas don't have, but you have a fruit in your boma. That is what you give your child. Diet is not about, it should not be expensive, but what you have and what you can afford.
Yeah, I see that. Thank you so much, Eunice. And sorry, tunakimbizwa because commercials, you know, we have to give way for that. Daktari, thank you so much for sparing the time. I think this conversation, we need to have more time. We have 5 hours to get you to and talk about it. But thank you so much, Dr. Doreen. Thank you so much, Eunice, Teresia, Wesley, Lawrence, asanteni sana for coming by today. And let's keep the conversation going online. That is at NTV Kenya. But for now, have yourselves a lovely day ahead. I'll see you tomorrow on Trendy Thursday. Goodbye for now.
Thank you.